Madam Wahida, and also to the fellow panel judges. So my name is Simon Shibin Zube. So today I'm going to present to you regarding my proposal defense entitled as the effect of sleep duration on cognitive function among banyak adult. So we proceed to the background of the study. So sleep. Sleep is recognized as the predictor of human health related to physical, mental wellness and overall vitality according to Ohio in 2017. Sleep is important because it provides both psychological and physiological function toward humans according to NEDLAC 2015. This is because when we sleep, there are 5 stages that involve. The first stage is the metabolic stage, which enhance the metabolic activity that lower our breathing rate and heart rate level. The second one is the endocrine system that secrete the growth hormone from our pituitary gland. The third one is psychological restitution and learning motor memory stages, which associate with the rapid eye movement, sleep, and also the sleep spindle according to State Goal 2011. So when we sleep, it also affects our cognitive function, and cognitive function can be defined as the internal mental process which underlie on how the people perceive, remember, speak, thinking, make decisions, and solve problems according to Benjamin 2010. In cognitive function, there are 3 major types, which is the working memory, which can define as the brain system that provide temporary storage and manipulation of information for complex cognition tasks according to Cato 2018. And the example is memorizing an information. The second one is educative function, who also known as the high level of cognitive process that facilitate a new way of behaving and optimizing one approach to unfamiliar situation. The example like when people from Malaysia go to the France, and these people will behave in a new behavior because due to a new environment at the France. And the third one is sustained attention, which described as the fundamental component of attention characterized by the subject readiness to detect an unpredictably occurring signal over a prolonged period of time according to Sutter 2001. So we proceed to the problem of statement. So recent study found out that a young adult suffer a sleep deprivation. According to Levinson 2016, sleep deprivation is defined as the lack of sleep or loss of sleep duration. Okay. Young adults also reported to have a decline in sleep duration compared to the young children and adults, according to Chaput 2012. This also associated with the decline of the cognitive function. So according to Simpson 2017, it states that lack of sleep consistently demonstrate to negatively influence a number of measures on the physical performance and cognitive function. However, one study found out that a longer sleep duration significantly associated with the decrease of cognitive function and memory according to Ostrom. So, this shows that there is no concrete guideline of sleep duration that enhance the cognitive function as can be seen from both evidence. So, the aim of the study is to investigate the effect of sleep duration on cognitive function among Seremban young adults. So, there are 3 major research objectives. The first one is the effect to investigate the effect of sleep duration on working memory among Seremban young adults. The second one is to investigate the effect of sleep duration on executive function among Seremban young adults. And the third one is to investigate the effect of sleep duration on sustained attention among Seremban young adults. So, we proceed to the significance of study. And the result of this study may provide benefit toward the young adult, athlete, and parents. The question is, how? Okay, the benefit gained from the study can help the young adult, but how? Okay, the young adult can utilize the result from the study in order to enhance their cognitive function throughout their everyday behavior, such as memorizing, problem solving, and decision making. This also will help them to improve their daily behavior. For example, young adult consists age from 19 to 25, which means young adult will be around students, teachers, workers, and all the people range from that age. So they will face many of situation and require to memorizing at work, at school for students, and also for problem solving when making a decision whether they are student or teachers. So with this result, they can use it in order to enhance their cognitive function, which will help to improve the memorizing the thing problem solving, and decision making. The second one is the athlete. Okay, as we all know, cognitive function is very important toward the athlete because the athlete require the good skill in decision making, problem solving, because it play a huge role in their performance. So, the result from the study also will make them realize the importance of sleep duration, and they can apply the result from the study in their daily life and help them to have a better sleep, in which we enhance their sleep hygiene. So, when their sleep hygiene improve, their cognitive function also will improve, and the side skill from the cognitive function such as decision making, problem solving, reaction time, and also memorizing will help to improve their performance depend on their sport. For example, like when an MMA fighter, okay, when their cognitive function enhanced, okay, they will have a good decision making during their fight in order whether to on how to attack their opponent. So the last one is parent. Okay, parents can use the result from the study and can use it to practice in their daily life. Okay, as we all know, parents nowadays has a busy lifestyle because they has to deal the pressure at their work, the pressure with their wife or husband, and also with their children. So most of them have lack of sleep. So the result from this study also will help them to realize the importance of sleep duration so they can apply it in their daily life. Furthermore, they also can apply the result from the study on their children because when they apply it on the young age, children tend to have a more greater cognitive function and hence will help their children to grow even better. So we proceed to the chapter 2 literature review. So sleep duration. Sleep duration is defined as one of the fundamental parts of sleep hygiene, which used to describe a process of behavior environmental modification to increase sleep quality, according to Nicholas 2020. So sleep progress in cycle which involve multiple of sleep stages as awake, light sleep, deep sleep, and rapid eye movement, according to Aboa Lyon 2015. Okay, this multiple stage also related to the what I presented earlier, which the 5 stage which consists of the metabolic activity, endocrine system, psychological restitution, motor learning, and working memory. Okay, sleep also provides of various of psychological and physiological function according to Neglect 2015, which I explained earlier in the chapter number 1. So, cognitive function. Cognitive function is a mental state that leads to impression of reminiscing, intellect, and action, according to Donnelly 2016. Cognitive function also can be divided into the working memory, sustained attention, and executive function, and all the aspects I explained earlier in the chapter number 1. So, working memory. Okay, as I mentioned earlier, okay, working memory also can be defined as a part of cognitive function that provide a momentary or temporary storage and control of data for complex cognition events such as memorizing information, according to Cato 2018. Okay, this working memory can be measured to the various tests, and one of the famous tests to measure the working memory is the NBAC test, according to Cato 2018. So, the executive function also can be categorized as a significant level of psychological produce that encourage a better approach for carrying on and enhance one way to deal with a new circumstance, according to Schneider 2015. So as I provide example earlier, people in a new country with a new environment and they need to deal with the new circumstances and need to develop a new behavior, and the cognitive function can be measured to the Wisconsin Sorting Cut Test, WSCT, according to Cato 2018. So, sustained attention can describe as consideration portrayed by subject's ability to recognize an eccentrically occurring signal over delay time frame, according to Nan 2010. And the test used to measure the sustained attention is the Continuous Performance Test, Identical Pair, CPTIP, according to the Cato 2018. So we proceed to chapter number 3, which is the methodology. Which is the methodology. So the first one is visual design. So for this study, it will use the descriptive method, and the type of descriptive method that will be used is the correlational study. This is because this study wants to see the effect of sleep duration on cognitive function on a mouse yang adult. So this study actually want to see the interaction between the IV, the sleep duration, and the DV, which is the cognitive function. So based on the objective of this study, which is to investigate the effect of sleep duration on cognitive function among yang adult. So this study will use the correlational study. So now with the sampling size. So for the sampling size, this study actually used a G-Power software, and this study target population is semua yang adult, and the population is actually unknown. So this is why we use the G-Power software, and the inclusion criteria is age between 18 to 25, healthy, no smoker, and no underlying medical disease. And exclusion criteria is all of the opposite inclusion criteria above. So the sampling size, okay, like I said earlier, we use the G-Power software. So according to Creswell 2011, at least 3 participants is needed in the correlation study in order to establish a relationship. So based on the G-Power software that has been analyzed, so the sample size will be 32 respondent, and 20% will be added in order to drop out. And the sample technique is a purposive sampling because we want to choose the participant based on the inclusion criteria that I desire. So this is the example, the evidence for my G-Power software. So the instrument, the first one is to measure the sleep duration. Okay, for sleep duration, we use the actigraph, or also known as accelerometer. This device is selected because this device has been utilized throughout the recent decade in sleep medicine, according to Sadeh 2011. And the actigraph reliability will increase by extending monitoring more than 5 days. So the data of actigraph can be read to the computer software. So the next one is the working memory. Okay, working memory will be test using the NBAC test, and the NBAC test is actually a test in the computer software. We require the subject to refresh the mental set persistently. So this is example of the NBAC test. And the next one is the executive function. So executive function, we will use the Wisconsin sorting card test according to Cato 2018. And this test is actually comprised of 2 cards pack having 4 boost card and 64 reaction card each. And each card has a different geometric shape, and the subject must require to sort every respondent card with 1 of 4 stimulus card throughout the feedbacks given based on the rules. The last one is sustained attention. We will use the continuous performance test, which is CPT-IT, and it consists of the 4 digit as we show in the picture, and each with the between boost interim of 950 milliseconds, and each session consists of 150 trial, and 30 target trial require a response. So this is the data collection procedure. Okay, the first one, we must take the ethical approval from the UiTM. Then we must ask permission to conduct the research from the subject. So because we want to know whether they're willing to do the test. The next one is the brief explanation regarding the study, the objective, and we give the actigraph for them to wear for the 7 days to measure their sleep duration. Then after 7 days, the subject will undergo the next test, which is the NBAC test, sustained attention, and executive function. So after that, we will collect the data from the test and the actigraph. Then we proceed to analyze the data. So this is the data analysis. So for data analysis, before we begin with data analysis, okay, the pilot study must be conducted first. This is because to ensure the reliability and the validity of the test. So the instrument will consider as reliable and valid if it's more than 0.08 of the combust. So based on the result objective of the study, this study want to see the interaction between the IP, sleep duration, and DV, which is the cognitive function. So the regression analysis will be used because we want to see the effect of one variable on the others. So we will use the IBM SPSS that will be set the p-value at 0.05, that will be significant, and the regression coefficient will be used as well to measure.